In Canada, the rate of suicide among First Nations people is 24 per 100,000 people per year, which is double that of the general population. Health Canada has found that most individuals who commit suicide have a psychiatric disorder such as depression and substance abuse. Due to incorrect or inadequate treatment for mental health issues, First Nations youths are seeking suicide as an alternative or an escape. In fact, in a study conducted in Manitoba, results show that nearly 7% of First Nations suicide victims had accessed psychiatric help before committing suicide, a shockingly low number when compared with 22% of non-First Nations victims of suicide. Of specific concern, First Nations boys and girls ages 10 to 19 in British Columbia are anywhere from 8 to 20 times more likely to commit suicide than non-First Nations youth of the same age. In an Ontario First Nations community, the suicide rate is 470 deaths per 100,000, which is 36 times the national average, making it one of the highest rates in the world.
The individual factors that affect suicide in the First Nations population are no different than those found in other populations, but the prevalence and interrelationships among these factors differ. Their history of colonization and subsequent interactions with the social and political institutions of Canadian society add structural barriers to coping with stressors. Despite significant improvements in the health promotion and illness prevention strategies, the health of First Nations people continues to lag behind the health of the rest of Canadians. Complex socio-economic and health inequities must be acknowledged before necessary change can occur. First Nations people living in low-income households with less than $25,000 of annual income display an almost 5 times more lifetime suicidal ideation than First Nations individuals in a higher income bracket.
In 1920, residential schools were developed by the Canadian government in an attempt to assimilate First Nations people into the national mainstream. First Nations children were physically removed from their families and communities and placed in residential schools, where they were not allowed to speak their own language or follow their own beliefs and traditions. Many of these children experience physical, emotional, and sexual abuse that has been perpetuated generationally. Upon the closure of residential schools, many children were placed in the care of the provincial government. This loss of culture and identity is associated with self-destructive behaviors among First Nations youth, as they identify the need to remain empowered in the context of their own culture. Research shows a relationship between the rate of suicide and the degree of control that First Nations individuals have in their communities.
In 1876, the Canadian federal government revised the Indian Act as a means to categorize, monitor, and control the First Nations population, referring to First Nations people as Indians and designating them as wards of the state along with children, criminals, and the mentally ill. Within this act is described how to best respond when a status Indian is deemed mentally incompetent. However, the action described create many ethical issues, such as the oppressive nature of removing someone's assets without permission.
Today, the healthcare system follows a medicalized approach rather than prevention and promotion, which dismisses the importance of First Nations culture, values, beliefs, and norms. This also results in there being no specific protocol or documentation that outlines how to provide safe and competent care for First Nations people suffering with mental illness who might be contemplating suicide. The Mental Health and Commissions of Canada has created a framework for mental health strategies that focuses on the importance of treating every person equally and in consideration with their own cultures and beliefs. In British Columbia, we have the Mental Health Act. However, it is not specific to First Nations mental health. Within this act, it is stated that every resident of British Columbia is entitled to receive services and accommodations in the facilities that fall under this act. In failing to provide adequate, culturally safe, preventative health care to First Nations people, we are not adhering to the Mental Health and Commissions of Canada nor the Mental Health Act.
Communities and health authorities have taken action to create initiatives and resources regarding First Nations people and suicide. On a community level, an initiative was created by the Okanagan Nation Response Team to provide a resource for individuals who are suicidal or whose lives have been touched by suicide. Additionally, the Northern Health Authority developed a resource for First Nations people to utilize when accessing healthcare services. The Aboriginal Patient Liaison Program offers accompaniment to healthcare appointments with a First Nations liaison. Unfortunately, there are no resources in Vancouver specifically for First Nations people experiencing a suicidal crisis.
In 2006, the Child and Youth Officer of BC developed a special report that outlined strategies to aid in decreasing suicide in First Nations youth by taking into consideration the culture and traditions of the First Nations people. If these strategies were implemented, it would help foster a positive relationship between the First Nations community and the government. In order to address the rising number of suicides in Canada, various organizations have formed guidelines for media reporting on suicide. Overall, these guidelines recommend to avoid excess coverage of suicide stories and to focus on positive First Nations role models and education.
We as nurses are in a position to be able to help First Nations people and communities cope with the rising incidence of suicide. New programs must be tailored to the needs of the specific community and address the underlying reasons to why the suicide rates in each unique First Nations community are higher than those of the general population. Health Canada states that prevention programs must be a long-term process that provides a range of prevention strategies and incorporates First Nations culture, beliefs, and health practices.